Hi, I'm Angela. I'm a product specialist at Mother's Choice Products. One of the things that we never want to talk about, but that happens to many of us, is incontinence. Incontinence is when you laugh or sneeze and you might have a leak, or you have to run to the bathroom because your body is telling you have to go right now. Those are symptoms of incontinence. If you have any concerns, obviously you should go to the doctor. But if you're just wearing a pad to contain the leaks and you're modifying your behavior, maybe you want to think about something else you can try. One of the things that can cause incontinence is a weak pelvic floor. We all know our Kegels are important, but how many of us actually know how to do them properly? Or even if your pelvic floor might be so weak that you can't actually do a proper contraction and relaxation to make your pelvic floor stronger. This is where a pelvic floor exerciser comes in. So TENSCare makes two separate pelvic floors exercisers. One is called the Perfect PFE and one is called the Elise. They have the same programs built in, but they work in a little bit of a different way. So the first one we're going to talk about is the Perfect PFE. So this is a battery operated, so it has just two AA batteries in the back. So how it works is you connect the lead, and it comes with a probe that you actually insert into your vagina. So just put a little bit of lubrication on it because it makes it easier, and then you simply slide it into your vagina just like a tampon. This probe will tell you that it's moving in the right direction. When it contracts, it should tip back. So make sure you put it in. There's a little shelf here that will prevent it from going in too far. So you simply connect the lead to your device by these little pins. Insert this into your vagina, put your feet up and relax for about 20 minutes, and then you turn your machine on. So if you know you have stress incontinence, so if you know that you run to the bathroom and when you sneeze and cough, you have leakage, then you would use the stress program. If you have to run to the bathroom quickly, that's called urge incontinence, so you would use the urge program. If you're not really sure, or you might have a combination of both, you would use the mixed program. Now the Perfect PFE also has a program for pain. So if you have pelvic floor pain, it can actually soothe the nerves in your vaginal area and take away some of that pain. So you choose the program that fits you. And once your probe is inserted, you just simply use the arrow button to find the comfortable milliamperage. So it will actually start to tingle. You will feel it and you will start to feel the contractions. So when you feel the contraction, if you want to go up a little bit more, you can, but you shouldn't feel any pain, but you should feel the contraction. There's a little countdown timer, and so what will happen is it will count backwards from 20 because you sit there for 20 minutes. So it's 20 minutes a day, and we recommend about 3 or 4 times per week. And in about 6 weeks, you should feel a difference. Some people feel it sooner, but most people it takes about 6 weeks before you really have a noticeable difference in your leakage. So the Elise works in a very similar fashion. It has a different probe and it also has a rechargeable battery. The Elise does not have the pain program, only the stress, urge, and mixed. So you plug in your probe on the bottom, and you can see this probe is slightly different, but it works in the same way. So you put your lubrication on the contact points, insert it into your vagina, sit down, feet up on your bed, propped up, hold the power button. You do have to hold it down for quite some time. You'll hear it beep and it will come on. And then choose your program, whether you want to use the stress program, the urge program, or the mixed program. Push your plus button until you find your body is you can feel the contraction. Go up 1 if you want to, or 2, but remember, it should not hurt. You should just feel the contraction. And then just simply let the machine do its thing. It takes most people about 6 weeks or so until they find a difference. Some people feel it sooner. Some people notice difference sooner. Some people, it takes a little bit of time. It depends on how weak your pelvic floor is and how much the muscles need to be made stronger. The other option is this is an anal probe. So if you are a man and you maybe have a post-prostatectomy and you have incontinence, this goes in your anus. It works the exact same way, and you plug it into the machine. Use your mixed program, and you can strengthen your pelvic floor if you're a man by using this probe. So these devices are Health Canada approved. They are safe. They are recommended. and you can buy them on leakybladder.ca. So if you have any questions, you can reach out to leakybladder.ca. You can also reach out to us here at Mother's Choice Products, and we'd be happy to help you find the device that fits your needs.